I've had a few cases of trigger finger that have come through the office lately, so I thought that would be a good one to talk about today. So, trigger finger, if you look at my hand, I have all of these tendons that run through my fingers. And what a tendon does is the muscle pulls on the tendon, and then that's what curls my finger. So, in a trigger finger situation, what happens is there's a sheath that sits around that tendon, and the sheath tightens up around the tendon, and then you get this bunching up that occurs right in there. And so the best way to approach that is you try to dilate the tendon sheath to get the tendon to move through it. And so one of the tricks that I'll tell people to use at home is if they just take and place their thumb on that tendon. So if you curl your finger, you can feel it, and just push and kind of push down and move the finger back and forth like that. And you're trying to free up where that tendon is caught in the tendon sheath. And then afterwards, take about a minute or so and then really stretch out the tendon so you can try to pull it through. If you picture, it kind of sits in a tunnel and you're trying to pull the tendon through that tunnel to break it up. So a lot of times when that happens, it's kind of slow, and so you don't know exactly what it is until you start to see it bunch up right there. So that's when you would want to start to try to break that apart. So try that for about a week or two, and if for some reason it doesn't seem to help, then give us a call.